Well, for more on this, let's talk to Angharad Rudkin. She's a child clinical psychologist at the University of Southampton in England. Thanks for joining us. What are the main psychological challenges that children face in this pandemic?
I think there's many, actually. I think that the lack of social contact with people outside their family is a big one. But I think also the intensity of living inside that family unit. So squabbles with siblings, rattier parents. I think it can all help to create quite a bit of turmoil for children, especially younger children who find it difficult to understand what is going on. But for teenagers in particular, they're a real worry, actually, because they rely so heavily on social contact with peers every single day to help them feel good about themselves. So they've really missed out on that as well. So there's a lot of psychological impacts, really. But one thing that I have found is that the young people that I was working with before this all happened, and I was working with them around anxiety, they're enjoying a temporary relief from their anxieties because they're now living in a bubble. And the things that used to make them feel really anxious, such as going to school or seeing other people, has actually reduced. So for some people, it hasn't been all bad.
Okay, so social distancing is particularly tough for young people, but what about the general psychological environment, living in a situation where there's a killer virus on the loose and people are dying in their thousands all around them? I mean, this must be a particular burden for them.
I think that threat is enormous, but from my experience, I think it's more the adults who've really processed that threat. Very young children, it's just too big for them to take on. They can't really understand the enormity of it, so we have to bring it down to the day-to-day, wash your hands, don't go near other people. For teenagers, I think they felt quite a bit of existential angst around it, but because it's not hitting teenagers as much as other age groups, I think they're feeling pretty protected from it, in fact. So the biggest threat is changes to families in terms of grandparents and elderly relatives and vulnerable relatives. Right. So a lot of young people are dealing with that threat okay, actually, and more what they're experiencing difficulties with is the day-to-day not being able to see their friends, for example.
What advice would you give to parents as a child psychologist to help them support their children in coping with this crisis?
It's a really difficult time, and parents are going to be putting a lot of expectations on themselves. And actually, it's the toughest job in the world at the best of times. So right now is going to be very, very tough. So as a parent, just set yourself small goals. What is it that you would like to do to make sure that that day's gone okay? A couple of things that you want to get done. Go very easy on yourself as a parent. But in terms of your child, don't worry about them having to, be incredibly educated during this time. You just need to tread water with the learning. A lot of parents are very anxious about screen time and how much time their children, especially teenagers, are spending gaming during the day. And again, it's just about having to just take a step back as a parent and think, what is it that I need to do right now? I need to keep my child well and safe and healthy. And these just involve little steps. They don't need to involve any big changes.
Thank you so much. That was Angharad Rudkin. She's a child psychologist at the University of Southampton. Thanks for talking with us.